Hi Zara, it's great to see you today. Congratulations on your first pregnancy. What an exciting time. How are you feeling about it all?
Hi, I'm not feeling too bad. A bit nervous about it all, but I am excited to be having a baby. I'm not really sure about breastfeeding though.
I totally understand you. I get that it can be a stressful time and it's quite concerning hearing lots of different things from different places. Would you be open for a discussion to chat about how you're feeling about it all and get some more information about breastfeeding today?
I'm just not sure. I've heard so much about breastfeeding and my mum and sister both struggled with it. From what they've said, it sounds so painful and I don't want to go through that. Plus, they said that formula feeding is best and that babies sleep better.
Okay, it sounds like your mum and sister had some challenges with breastfeeding and that has concerned you quite a bit. You also mentioned that your baby getting good sleep is really important to you. Can you tell me more about what makes you feel that formula feeding might be the best option for you?
Yeah, my mum always says that breastfeeding is very painful and she couldn't produce enough milk. I'm also worried about the sleep thing. I've read online that formula fed babies generally sleep better. I'm worried I won't get enough sleep as I'm up all night trying to breastfeed. So I might as well go straight to the formula.
Okay, yeah, sleep is quite important. It sounds like you're feeling torn between what you've heard from family and what you've read online as well. Um, I'd like to know, though, on a scale from 1 to 10, how important is the idea of breastfeeding to you given everything that you've learnt so far?
I'd say maybe a 4. I know it's supposed to be better, but I'm just worried about all the challenges that come with it.
Don't feel disheartened. That's really understandable. You're weighing a lot of different factors right now, and it's totally okay to feel uncertain with your decision. You've already thought about what's best for your baby's health and that you want to prioritize that for them, and that's a really great first step. What I'd like to do is share some information that might help you understand more about breastfeeding. Is that something you're open to?
Yeah, okay.
Okay. I hear your concerns, so I want to share a few points that might help clarify things for you today. Firstly, I want you to know that it's completely normal for breastfeeding to be challenging at first, but many women after the first few months do find that it gets easier. The first few days are particularly crucial for both you and your baby to get the hang of it, and the more practice you get, the better it is going to get. Colostrum is the first milk produced after birth, and it's really, really rich in antibodies and nutrients that are extremely beneficial for your baby's health. As for the pain, I can't say that it won't be painful because a lot of women do experience some pain, but it does get better. There are lots of things that we can do to make it better as well and more comfortable for you. When it comes to the health of your baby, breastfeeding has been shown to have a huge range of benefits. It is uniquely suited to the needs of your baby and it provides the best nutrition for babies with all the vitamins and nutrients that they need, especially for the first 6 months in life. Breast milk is also packed with antibodies that help protect babies from illnesses and infections which formula just can't replicate. Your body actually changes the contents of its milk over time depending on what your baby's needs. Studies have shown that breastfed babies have lower rates of asthma, allergies, obesity, and even type 2 diabetes later in life. Not only that, but it also promotes a healthy gut microbiome, which is key to developing your baby's immune system along the way. In terms of sleep, I get why you're concerned. It is so important, and it is true that babies who are fed with formula tend to sleep for longer stretches at a time. But there's also a lot of evidence that breast milk contains a hormone called melatonin, which helps babies regulate their sleep-wake cycle and eventually leads to longer sleep and better sleep quality in the future. Breastfeeding also promotes skin-to-skin contact for you and bub, which enhances bonding and emotional connection between yourself and your new baby. This is important for the baby's emotional and social development too later in life. The act of breastfeeding can also provide comfort to the baby and help them feel secure, and it's quite a nice bonding moment for the two of you. Breast milk is easy for babies to digest. The prebiotics in breast milk promote the growth of healthy bacteria, which can reduce the likelihood of gastrointestinal issues like colic and constipation.
Okay, wow, that is a lot of information. I'm still not really sure about it all. It just seems really difficult.
Yeah, I understand it is a lot to take in all at once. I do have some brochures here that I'm going to send you home with, and you can have a discussion with your family as well, and you can go over it, and you don't have to make any decisions right now. We've still got a few weeks, and then we can come back and discuss it again if you like.
Great,
Yeah, sounds good. I do understand that your mum and your sister had difficult experiences, and that might make you feel like breastfeeding isn't quite worth trying because the two people closest to you have had tough times. But I want to reassure you that many women today are successfully breastfeeding, even if they had initial struggles. Support from lactation consultants, midwives, and other health professionals can make a big difference in overcoming these challenges, and we're all available and here to help you. The fed is best message is common, and while it's absolutely true that feeding your baby is the most important thing, we also know that breast milk is uniquely suited to your baby. It's really hard to replicate its benefits with formula. I know the health of your baby is a big priority for you, but breastfeeding is also beneficial to you yourself. It can actually help the uterus contract and return to its pre-pregnancy size, reducing the risk of postpartum bleeding after birth. It also has been studied that breastfeeding can lower the risk of breast and ovarian cancers in mothers, as well as reducing the risk of osteoporosis later in life. Breastfeeding also promotes the release of oxytocin, which is your happy hormone, and can help with reducing the risk of postpartum depression after you give birth as well.
Yeah, okay.
I can hear that you're trying to balance all of these factors, and it's a lot to take in, and you really want what's best for your baby, which is brilliant. Yeah, that's what we want. What do you feel would be the most important thing for you to consider when deciding whether to breastfeed or not, now that you've heard some of this information?
I just want to do the best thing and the healthiest thing for my baby.
Yeah.
And I feel like I'm doing a good job as a new mum. I also don't want to struggle with breastfeeding if it's going to be painful and stressful.
Yeah, that's understandable. It sounds like you do really care about giving your baby what's best in life, which is so important, and having a positive experience with breastfeeding and becoming a new mum. I really do believe, though, with the right support, we can work together to make breastfeeding something that feels good for you and works for you, and I'm here to help with any concerns you have along the way.
Okay, maybe it's something we can try.
Okay. It's great that you're thinking about all of these things, Zara, and you're considering it now. From our conversation today, it sounds like you might be open to trying breastfeeding, but you're still worried about the challenges. Ultimately, it is your decision to make, and we want to support whatever decision you do make. What if we set up a plan where we could work through any concerns you have, and then you could feel supported along the way and know exactly what you think?
That sounds like a good idea. I'd like to give breastfeeding a try and see how it goes, but I might need some extra support along the way.
Yeah, of course. We can set up regular check-ins, and I'll be here to support you every step of the way. If anything comes up, we'll address it together if you hit a tough spot. Does that sound like something that could work for you?
That sounds like a really good plan.
Okay. You've made a really thoughtful decision to give breastfeeding a try, and I think it's fantastic that you're willing to take this step knowing more information now. Remember, you are doing an amazing job already, and I'm here to support you along the way.
Thank you so much.
My pleasure.